Dear friends, so many patients ask me, doctor, please advise what are the home remedies that we can do for orthopedic products, right? So I will cover two important things. One is cut wounds, and second one is whenever there's some injury, sprain or strain of the ligaments or any injury, how you have to take care in the house before meeting your doctor, right? So these are kind of first aid things, right? First aid, the first rule of first aid is that do no harm first. Okay, see that you don't produce any harm whenever there's an injury. So, like suppose whenever a child falls, no, the mother instinct is that the parents, especially their instinct is that they will go and they'll start rubbing. Suppose the child falls on his forehead, there is some swelling there, they'll start go and rubbing it, or anywhere on the head, no, they'll start rubbing it. Please don't ever do that. Rubbing, pulling, and all those things should be avoided. So you are causing more harm if you do the massaging or things like that. No, there's a lot of once again friction there, and a lot of inflammation, pain, swelling will definitely increase by doing that. So please do avoid doing such things. What you have to do, take the child to a safer place. Then there's a simple formula called as RICE, RICE. You have to give the rest to the injured part. Suppose if there is any, if you suspect some fracture, you can apply some sling or some support there so that the part injured part is rested. Then then I for ice packs. Okay, ice packs you can take some ice cubes, put it in either a kerchief or in a plastic cover and put wherever there is injury, right? So then see for compression bandage, if you have any compression clip bandage available, you can apply clip bandage. If not, you can just tie a towel or whatever it is, medium, don't apply too much apply, medium you can put a compression there. Then E for elevation, keep the part elevated so that pain and swelling will come down. That's the whole idea, right? So these are the things you have to do whenever there is an injury, whenever a child falls, whenever some person falls. Okay, so don't ever these are things to be followed whenever there is a blunt injury, contusion injury, or whatever it is, right? What I have to do if there is a cut injury? So there is a lot of bleeding. Once the people see a lot of bleeding there, which is especially the bleeding over the face and skull, they will bleed more, right? So people will become panic. What they will do, they'll apply whatever they get, especially village patients. Even today I'm seeing some people would have come with a lot of mud applied. So immediately they'll get that's it. So when the child falls there, no, they get the mud only surrounding the sand or mud, they will take and they will apply. Some people have applied clay also that they wanted the bleeding to stop. Don't ever do that. Okay, some people have even applied cow dung, and some people they have applied, especially in the house, no, mothers or mother-in-laws or some grandmas, they will advise to put some turmeric powder. Turmeric powder, that's a bit okay, but even I don't advise that also, because after you come to a doctor, removing the turmeric powder or the sand or whatever things you put, that itself will takes more time than putting one or two switches, right? So there's no need to put all those things to stop the bleeding. What you have to do to stop the bleeding is very simple. Take a clean cloth, or if you get a cloth, it's fine. If there is no cloth, you kerchief, nothing to worry. You can use your palm, clean palm. Of course, you can wash your hands and use your clean palm and just apply direct pressure over the wound, right? Right, apply the pressure. You have to hold minimum for 3-5 minutes, sometimes even 8-10 minutes also, so that the bleeding will stop. Okay, if you apply for 1 or 2 minutes, it won't stop. You have to apply constant pressure, keep putting pressure there for about 5 to 8 minutes or so. Okay, so once the bleeding stops, you can remove your hand. That's the best way of stopping the bleeding, right? And if there is any wound on the hands or something in the legs, you can keep the limb elevated. If you keep the limb at higher level, automatically the venous blood will venous injury causing blood loss will be reduced, and any bleeding from the capillaries and arteries can be controlled by putting pressure. Okay, if you do these things, bleeding will automatically stop. Then you can rush to your nearby doctor or hospital, wherever it is possible. They will always take one TT injection also, any cut wounds. It's very important, and don't ask for tablets instead of injections. TT is always available only in the injection form. Please do take one injection DT, and rest of the things, if it is needed, if it is deep wound, your doctor will definitely put 1 or 2 switches if it is needed. Okay, so these are the home remedies. Please, I have done so many videos, more than 250 videos, such videos. Please do subscribe my videos. It is Dr. Muralidhara Ortho. It's very easy. Please do subscribe and forward it to your family and friends. All the best.